Alright, in this video, we'll talk about the axilla. We'll talk about its shape, boundaries, contents, and clinical importance. Now, anatomically, what you're seeing here, this hollow that you can see here, is just the base of the axilla. Now, the axilla itself is much deeper than this. Now, the axilla is a pyramid-shaped space located between the upper limb and the side of the chest wall. Now look at this diagram. Now this diagram shows what the axilla actually looks like internally. Okay, so the axilla is a truncated four-sided pyramid. So it's pyramidal in shape, and a truncated pyramid actually, which means a pyramid with its tip cut off. Okay, so the narrow upper part connects to the root of the neck, while the wider lower part forms the base, which is what you see externally as the armpit hollow. Okay, now we've talked about the shape of the axilla. Now let's look at the boundaries of the axilla. Okay, so the boundaries, the axilla has an apex, a base, and four walls. An apex, a base, and four walls. So these forms the boundaries of the axilla. Now let's look at the apex. Now this is the apex of the axilla. Okay. Now let's look at another diagram to show us a better view. Now this is the apex of the axilla. Now the apex is the narrow upper opening of the axilla. Okay, so it's also called the cervico-axillary canal. Cervico-axillary canal. Okay. All right. Now the apex of the axilla is bounded anteriorly by the posterior surface of the clavicle. Now this is the clavicle, right? And its posterior surface forms the anterior boundary of the apex of the axilla. Now the posterior boundary is formed by the superior border of the scapula. Now this is the scapula. So its superior border forms the posterior boundary. Now the medial boundary of the apex of the axilla is formed by the outer border of the first rib. Now this is the first rib. So its outer border forms the medial border or the medial boundary of the apex of the axilla. Okay. Now the apex of the axilla is important because it allows structures entering and leaving the upper limb. Okay, structures like the arteries, veins, and nerves. So they must all pass through this confined space. Right? They must all pass through the apex, which is also called the cervico-axillary canal. All right. Now we've talked about the apex of the axilla. Now let's talk about the base of the axilla. Okay. Now this is the base of the axilla. Okay. Now the base of the axilla, forms the floor of the axilla. So I call it the base of the floor of the axilla. The structure you see externally as the hollow of the armpit. Okay, that's this. Now the base of the axilla is formed by skin, superficial fascia, and axillary fascia. So these structures forms the base of the axilla. Now let's look at another structure to show us better the base of the axilla. Okay, now what you see here is a sagittal section, and here we have the anterior axillary wall, and here we can see the axillary fascia, which forms part of the base of the axilla. So here is this part is anterior, this is posterior, this is superior, and this is inferior. Okay, so the axillary fascia, so we say that the base of the axilla is formed by skin, superficial fascia, and axillary fascia. Now this is the axillary fascia. Okay, now it's very important to note that the base, the whole of the base, is bounded anteriorly by the anterior axillary fold, and posteriorly by the posterior axillary fold. So somewhere here should be the posterior axillary fold, and medially by the lateral part of the chest wall. Okay, so we have the anterior axillary fold here, and here we have the posterior axillary fold, and medially we have the lateral chest wall. So this forms the boundaries of the whole of the base of the axilla. Now the axillary fold is formed by the lower border of the pectoralis major muscle. That's the anterior axillary fold, while the posterior axillary fold is formed by latissimus dorsi and teres major muscle. So the base lies between these two muscular pillars. Now let's look at this diagram again. Now you can see that the axillary fascia is drawn upward by this structure, and this structure is called the suspensory ligament of the axilla. The suspensory ligament of the axilla, and this suspensory ligament of the axilla is essentially a fibrous extension of the clavipectoral fascia. So it's attaches to the axillary fascia and pulls it upwards. So you can see now that the floor of the axilla, or the base, becomes concave externally. Okay, so which is what produces the characteristic hole of the armpit. When you put your hand in your armpit, so you feel this hollow structure. So it is because of the suspensory ligament of the axilla attached and pulling on the axillary fascia. Okay, so that's for the base of the axilla. Now let's talk about the anterior wall of the axilla. Now the anterior wall of the axilla is formed by the pectoralis major muscle, that's superficially, and deep to it we have the pectoralis minor muscle. So superiorly we also have the subclavius muscle. Okay, so these structures form the anterior wall, or these muscles form the anterior wall of the axilla. Now let's talk about the posterior wall of the axilla. Now the posterior wall of the axilla is formed by the subscapularis muscle, the teres major muscle, and the latissimus dorsi muscle. Okay, now the medial wall of the axilla Now this is the medial wall of the axilla. The medial wall of the axilla is formed by the upper four ribs and their intercostal spaces, and covered by the serratus anterior muscle. All right. Now the lateral wall of the axilla is actually very narrow. So it is formed by the intertubercular sulcus of the humerus, the coracobrachialis muscle, and the short head of the biceps. Now let's look at another structure to see clearly the walls of the axilla. Now this is a horizontal structure that shows the boundaries and contents of the axilla. And we are looking at this structure from above. Okay. Now this part is anterior. This is medial. This is lateral, and this is posterior. Okay. So this is the humerus. So we are looking at a transverse horizontal section from above. Now we say that the anterior wall of the axilla is formed by the pectoralis major muscle superficially, and deep to it we have the pectoralis minor muscle. So we also say the subclavius muscle, which is not shown here. All right. So we say the medial wall is formed by the upper four ribs and the intercostal spaces, and then we have the serratus anterior muscle. Okay. So the posterior wall, we said, is formed by the subscapularis muscle, the latissimus dorsi, and the teres major muscle. Now the lateral wall, we said, is very narrow, okay, and it's formed by the intertubercular sulcus, the coracobrachialis muscle, and the short head of the biceps forms the lateral wall of the axilla. Okay, so that's for the walls of the axilla. Now let's talk about the contents of the axilla. The contents of the axilla. So we have, the axillary artery and its branches. The axillary artery and its branches. Now this, you can see the axillary artery. So we also have the axillary vein and its tributaries, the axillary vein and its tributaries. So we have here the axillary vein. So we also have the cords of the brachial plexus, the cords of the brachial plexus. So we have the posterior cord, we have the lateral cord, the medial cord of the brachial plexus. Okay. So we also have, as part of the contents of the axilla, we also have lymph nodes, axillary lymph nodes. Okay, so these axillary lymph nodes are arranged in 5 groups. So they are the anterior group of lymph nodes, the posterior group of lymph nodes, the lateral group of lymph nodes, the central group of lymph nodes, and the apical group of lymph nodes. Okay, so the lymph nodes are not shown in this structure. So the axillary lymph nodes, they're about, actually about 20 to 30 in number, and they are arranged in 5 groups: the anterior, posterior, lateral, central, and apical group of lymph nodes. So we also have axillary fat. It's part of the content, axillary fat. We also have, specific nerves like the long thoracic nerve, and the intercostobrachial nerve, intercostobrachial nerve. So as part of the content, we also have the axillary tail of the breast, the axillary tail of the breast, which is an extension of the breast tissue inside or into the axilla. So these are the contents of the axilla. Okay. Now let's talk about the clinical implication of the axilla. Okay. So we have axillary abscess. Axillary abscess. Now infection may lead to pus accumulation in the axilla. Now when draining an abscess, the incision is made through the floor of the axilla, in the midway between the anterior and posterior axillary folds, closer to the medial wall of the axilla, and this is to avoid injury to the axillary vessels and the brachial plexus. Okay, so we also have axillary lymph node examination. Axillary lymph node examination. Now, most lymph from the breast drain into the axillary group of lymph nodes. Therefore, in examining the breast, the axilla must always be palpated. Enlarged, hard, or fixed, lymph nodes may indicate metastasis. All right, may indicate metastasis. Now we've come to the end of this video. We've talked about the shape of the axilla. We talked about the boundaries of the axilla. We talked about its contents and clinical importance. All right, so I hope you understood what the axilla is about. I hope you gained some value in this video. So thank you so much for watching this video and see you in my next video.